Wageningen University and Research Center has international students and staff from more than 100 different countries. You come here to study or work, but what do you do when you are ill? The Dutch healthcare system is likely to be different from the healthcare system in your home country. This film shows what you can expect from healthcare during your stay. International students and staff, a general practitioner, and a student psychologist talk about their experiences.
When I was in Mexico, I used to have a kind of a general practitioner that was the doctor of the family, and visiting him, it was also like visiting a friend. I mean, you had a closer relation, and then here you have to start from zero, and in English, and in a different culture.
In my country, this is pills and measuring the temperature and the heart rate and whatever. And then I came here and all this theater play didn't take place, and I was quite disappointed.
In Holland, the doctor when you have disease, the doctor wants your body to cure themselves. But in China or in many Asia countries, the doctor prefer to use medical against those diseases. They want to use the medical to cure those diseases.
In Wageningen you can find several health facilities, general practitioners to treat most basic health problems, dentists for dental problems, the hospital and aide for emergencies and specialist treatment, pharmacies for medication, and the vaccination center for vaccinations and advice if you go back home. The general practitioner, called huisarts in Dutch, has a key position in the Dutch healthcare system. You can choose your own general practitioner or register with the practices which have a contract with Wageningen University and Research Center and therefore will accept all international students and staff.
For me it was important to have a female general practitioner because a general practitioner also helps you when you're pregnant and does a lot of things that in my country a gynecologist would do. I'm not comfortable talking with a man about these intimate things, and therefore I wanted to have a woman.
How to register or make an appointment depends on the practice. In the practice of Van der Duin and Van Dinter in Wageningen, you can make an appointment through internet or phone when you're ill. On your first visit, you have to register by downloading and filling in the registration form. When you call for an appointment, you will first speak with an assistant with a medical background.
Once I have the flu, I will feel so bad, then I call the doctor. And yeah, and they cannot even reach the doctor. It's the reception lady, she talked to me. He said, you probably just have flu. If you still feel bad after 1 week, then you can come to us. Yeah, thank you. Okay, bye. If I have flu in China, then the doctor is gonna give me a lot of medical, and I even maybe stay in hospital for a couple of days to stop the fever. And maybe I'll even have the injection or something.
It happens quite often that international students are coming for a common cold and they're coughing for some days or sometimes having a little bit fever, and then they are expecting to get antibiotics because they are used to get antibiotics back home. And then it's different in the Netherlands because this is a viral infection and it's a self-limiting disease, so then we are not giving the antibiotics, and sometimes it can be difficult to explain this to the students.
So dealing with health problems might be different in the Netherlands. International students and staff also experience differences in the relationship and communication with health professionals.
Yeah. Okay, you can come. Good afternoon.
In Mexico, you go in and maybe they ask you, okay, how are you, how it's going? And the people are not so direct, so
Okay, you can sit down.
Okay. Everything goes very fast, so then you should not spend time going around how you feel. Just go directly to the point. Tuesday I started to feel bad.
Some students experience difficulties in asking questions about their health, and they maybe don't think it's polite to ask the doctor. We encourage the students to talk about what they think and what they want to know, and what all kinds of questions they have.
The general practitioner can treat most health problems. If you need to see a specialist, she will give you a referral letter. It is not possible to visit a specialist in a hospital without a referral letter. If you need medicine, the general practitioner will send a prescription to the pharmacy where you can pick up the medicine.
Good afternoon.
Good afternoon.
The doctor sent me some prescription.
You register with a pharmacist who keeps a record of the medicine you take and explains the usage of medication.
So I have the medicine for you. You have to take it 3 times a day,
Yes.
for 6 days. After you have finished, all the complaints must be over. Okay, forgot. Unfortunately, you have to pay something for it.
Sometimes you have to pay for a medicine or treatment. Refunding depends on the insurance you have. When you have basic health problems, you contact the general practitioner. But what do you do in case of an emergency? Thomas talks about his experience.
We were going to do a barbecue because it was the first nice weather, and we were all standing around the barbecue, 4 of us, and somebody tried to set fire to the barbecue, so he put oil on it, and suddenly it just set on fire, and I had like a third degree burn here. And so yeah, I took a cold shower, and then somebody called the ambulance.
In case of a serious accident or emergency, you can call 112. You have to give your name, location and reason for calling, and they will send the ambulance, police or fire brigade.
You can really communicate with them and ask questions, and they can answer, and yeah, it's nice. The first time I came in the hospital, they asked me for the European insurance, but the one I had was expired. And so they made me pay €300 because I didn't have the right documents. And the next time I came back with the right document, the European insurance card. And so there was no problem. They just said, okay, you don't have to pay anything, you can go and see the doctor.
Next to the medical care provided by the general practitioner and in hospital, Wageningen University has other services concerning the health and well-being of students and staff. Student counselors can advise students on practical and personal matters, such as finances, housing or study delay. Students can talk with a student psychologist about personal problems such as homesickness, depression or study-related problems. Students can go to a confidential counselor in the exceptional case that they experience unwanted behavior, such as sexual harassment, bullying or discrimination. For international staff, other services are available. The company doctor for medical issues, the occupational social worker for questions connected with work, and as for students, the confidential counselor for unwanted behavior.
My father died in 2011 after a long and severe illness, and I had problems working on my thesis in a concentrated manner. So I went to my study advisor, and my study advisor contacted the student psychologist and told her about my situation. I filled in a form to describe my situation again, and that I found quite difficult because you kind of undress yourself on a piece of paper towards a person you do not know. I sent that back and then had some conversations with the student psychologists, and it was very helpful.
Hi, Francisca? Yeah. Nicolemus, welcome.
Nice to meet you.
This way. Okay, nice seat. Well, what we often see is that a lot of international students suffer from homesickness. and they find it difficult to adapt to the Dutch system, to the Dutch society. And then in such cases it's good to talk about that, and we can offer help, and we can help to learn skills how to cope with the requirements of living and studying here in Netherlands. And of course our goal is that they will have a good time.
The key to enjoy like your stay in Wageningen is to try to meet new people, because there is a lot of international people, so there is a lot of stuff to learn. So don't stay on your own, just try to meet people.
You get sick and you are alone in your room, and that can be really hard. And then how to deal with that? Understand that there are many other students that are in the same position as you, that are also alone here, and that will perfectly understand your situation, and they are perfectly willing to help you.
When you come here and you go to a doctor here for the first time, you inevitably come with expectations concerning doctors you got from your home country. I would advise you to leave that away and to just try to look at things as they are here.
I don't know which way is better, it's just different. And it is how it is, but since you come here, then you should, maybe you should try the Dutch style or the Western style and to see if it works. And it works fine on me. So